Hi, I'm Reiley and I'm an occupational therapy student at the University of Indianapolis.
What is occupational therapy?
Occupational therapy is a skilled, evidence-based treatment that helps people become successful in their occupations. Occupations are things like activities of daily living, which are necessary activities to help you get through your day, such as bathing, grooming, and feeding. And instrumental activities of daily living are more complex and help you to live independently in the community, things like managing money, medications, and home maintenance. Other occupations are rest and sleep, education, work, play, leisure, and social participation. Next, we have some videos depicting how we would work with our clients. In this video, a client and a therapist are practicing toileting using grab bars and a raised toilet seat.
Here, the therapist is working with a client on self-feeding. She teaches the client how to use the adaptive utensil so he can do it independently.
Here, the therapist is practicing dressing techniques with a client who has motor deficits on their right side. The therapist is teaching the client to modify the task to improve his independence in dressing.
Here, the therapist is working with the client on a laundry task. They've placed the basket on a chair to make the task easier for the client, and she is providing stabilization through the gait belt throughout the task. Occupational therapists are also able to fabricate and educate clients on custom orthoses for musculoskeletal or neurological conditions. Here, the therapist is donning the neutral wrist orthoses for the client.
We can also help clients with transfers and teach them how to use adaptive equipment so that they can perform functional mobility to be able to get around and do the things they need to do from day to day. Occupational therapists also use a variety of modalities to aid clients. Here we are using NMES to stimulate muscle contraction of the wrist extensors.
Occupational therapists can also address sensory regulation, specifically in the pediatric population. Here, a therapist is providing proprioceptive input to a client through deep pressure by rolling the ball over her back.
Occupational therapists do not just work with clients in the clinic. We can also take clients out into the community to practice community mobility and address barriers that they may encounter in their everyday lives. So some of the settings that occupational therapists can work in are hospitals, home and community settings, long-term care, mental and behavioral health, outpatient clinics, schools and early intervention, and academia and research. We work with populations of people of all ages who are affected by injuries, surgeries, genetic disorders, illnesses, developmental delays, psychological disorders, disabilities, and more. Some examples of these common diagnoses that we work with are neurological disorders like stroke or traumatic brain injury, mental health disorders, developmental disabilities, intellectual disabilities, amputations, upper extremity injuries, cognitive conditions, arthritis, low vision, sensory dysfunction, chronic pain, lymphedema, and burns.
So why does occupational therapy matter? Occupational therapy can help clients by maximizing their function, increasing occupational performance and participation, supporting their recovery process, improving their quality of life, enhancing client outcomes, and preventing injury and illness.
As you can see, there's a lot of different things that occupational therapists can do.
If there's one thing you take away, remember that occupational therapists work with clients across the lifespan to help them do the things they need to do, want to do, and are expected to do in their daily lives.